Good morning, everyone. Thank you for the very kind introduction. I am Dr. Maynila Domingo I studied at Pamantasan Lungsod ng Maynila, trained at Hospital ng Maynila, PGH, ayan. Kasi para sikat po ako, Maynila din. Okay. So, actually, this is the first time that I attended this type of gathering of women. I am used to lecturing in scientific fora, and I never realized how scary it is to stand in front of non-doctors. Okay, but I think that while earlier I was chatting, I wanted to learn what this is all about, this organization and their goals, their purpose, no, and their advocacies. And I realized that maybe I have a place here, no? First time standing in front of CEOs. Ang alam ko lang pong CEO, yung mga nasa telenovela, Korean novela na pinapanood ko pag hindi tayo duty. So, but women's health, as mentioned, is really a very important topic, and health education, I think, is a very important part of women empowerment. So health issues among women, one of the most common cause of maternal and neonatal and childhood death, no? And morbidity. When we say morbidity, something na maybe not resulting in death but causes significant disability. So all of those can be addressed, no, earlier prevention just by educating women. So when I was invited by Sir Ray Munyar, I used to talk to them about hypertension. No? So I am an obstetrician gynecologist, and I specialized on high-risk pregnancies or perinatology. So high risk. So when ma'am said about she was I can relate, no? And in PGH, in Hospital ng Maynila, I'm also affiliated with Jose Reyes. We see a lot of our impoverished kababayan, mga Pilipina, who die. No? And health issues in women really can have long-lasting impact. No? Maybe they survive, but consequences, no, in terms of their quality of life. So yes, ma'am, you're very, very lucky. So in truth, after 14 hours of being brain dead, the risk of having disability is really high. So I agree. So, and what's empowering is that you see these types of miracles every day, and that, I guess, what pushes us to do our best. Very frustrating po yung healthcare sa Pilipinas. Yes, I've only been in government hospitals. Right now in my private practice, I also go to the private institution, and you see the disparity. Okay? So when I was asked, Doctora, can you talk? Go, of course. Sabi niya, what do you want me to talk about? Hypertension? Sabi niya, no stretch marks. Sabi ko, stretch marks? Sa hierarchy ng leading cause of death, no? Hypertension, infection, preterm labor, no? Stretch marks. Okay, stretch marks, why not? No? But I guess, no, this is a really important issue also among women. Okay? And each stretch mark tells a story. So I wanted to say that my stretch mark tells a story. So in the next ilang minutes na lang po ba, let me bore you, no? I actually revised a little my discussion. Earlier, sabi ko, sorry, it seems a bit too scientific. Baka makatulog sila. So ganito na lang, may quiz later. Para sure na marinig na. So first, what are stretch marks? We all know, no? Stretch marks. In Filipino, sometimes we call it kamot. Naku, huwag kang magkamot. During pregnancy, you will have stretch marks. But in reality, it is actually a type of scar. And it's caused by basically lack of collagen and elastin, making the dermis or part of the skin very weak. So if there's sudden growth, maybe because of getting pregnant, weight loss, no, gaining weight, and then, so the skin breaks and it forms a scar. Some people are very lucky. They don't have stretch marks. So not everyone, hindi tayo lahat, tinimbang ka ngunit kulang. Hindi tayo pare-pareho, right? So, lahat kayo, when you go home, ask your mom, May stretch marks po ba kayo? Tapos pag meron, sabi mo, kasalanan nyo tong lahat. So genetics play an important role in the development of stretch marks. Yes, no, but it's a natural occurrence. No, sometimes our skin really weakens over time because of lack of collagen, elastin, and sometimes because of nutritional deficiencies. So that's another very important topic among health, no? Nutritional deficiency and lack of exercise is one. And sometimes there are medical conditions and some medications that increases the risk of a woman developing stretch mark. So it's not just seen in pregnant women. Ayan. So it's most common in pregnant women because there's sudden enlargement of the tummy of the abdomen, right? So initially it appears red, no? And then it changes its color, no, bluish, gray, and then over time it may lighten. Yes, ganyan po talaga yung itsura sa iba. Pero sometimes even if you're not pregnant, no, adolescents, diba, they go through puberty, sudden growth spurt, and then they become conscious. They lose weight so rapidly. So they can also have stretch marks, no? In the thigh, buttocks, and arms. So issue siya, not just of women, but also men, no? But mostly, mas affected women. About women. So we wanted to know how do we treat them. So, but first, no, some women sabi, don't be ashamed if you have stretch marks because these are your battle scars. Because you underwent growth. You had change in your life. And these are just manifestations of those changes. So it's nothing to be ashamed of. And yes, we agree. It is nothing to be ashamed of. No, it's a physiologic process. In fact, no, wala naman pong morbidity and mortality caused by stretch marks. Wala pa po tayong nabalitaan. Okay? Wala pa. Directly. But maybe, in a way, indirectly, it causes some degree of morbidity among women. So later, I'll expound on that. So, of course, because meron siya, what should we do to treat it? So what are effective treatment options? So there are a lot actually in the markets. Creams, lotions, oils, no? And even medical procedures, no? But which one is effective? Researches have shown that not one is superior over the other. In fact, yung talagang removal of stretch marks are done by medical procedures, lasers, chemical peel, radiofrequency, ultrasound, etc. No? But we have certain creams, lotions, gel, or oil that can help lower or diminish the appearance of stretch marks. So how about home remedies? Sabi ng matatanda, yun nga, wag na lang kamutin. Wag kamutin. You know, just a side note, during pregnancy, women really suffer from pruritus or itchiness. They can't help it. No, why? Because of the changes in the hormones. And sometimes, no, it's significant such that di sila makatulog, no, they develop rashes over their skin. So to tell them, wag mo kasing kamutin. Have discipline not to scratch. Sometimes it's difficult po. Sometimes they are not aware. No? So let's be kinder to pregnant women. Okay? How about home remedies? Vitamin E, mga virgin coconut oil, aloe vera, cocoa butter. Unfortunately, research didn't show very significant impact on the appearance or diminishing the appearance of stretch marks. But of course, that can still be one of our options, no? How about tanning? So yung iba magpapatan na lang para makover yung stretch marks. No, because that part of the skin will not change its color. So it will not disappear even if you become tan. Okay, so if you are really bothered by the appearance of stretch marks, let's go to the doctor, to the dermatologist, no, to discuss treatment options if really needed. Okay, so rarely does it cause other symptoms such as pain or itchiness, no, or infection. Very rare, but it can happen. Okay, how about, so in medicine, we always say prevention is always better than cure. Pag nandyan na yan, di ba? Remember we said it's a type of scar. So a scar is permanent, right? So prevention of scar, better. No? So yung mga women, they will, emergency na, no? Misis, yung heartbeat po ng baby nyo bumabagal. Okay po, Doc. Pwede po bang bikini cut? Okay, so bikini cut, no? So because you in that discussion, no, in that conversation, you see that in a way, it's also important for them, 'di ba? Even if it's life or death situation. Right? So prevention. Bakit paano natin siya i-prevent? So sabi, remember earlier I said it is caused by the lack of collagen and elastin, making that part of the skin, the layer of the skin, weak, easy to break when stretched. So anything that boosts the production of collagen and elastin is thought to prevent stretch marks. Okay? Newer substances that we study now, so there are several researches going on, yung centella or hyaluronic acid. So wag muna po kayo agad bumili lahat-lahat ngayon ng mga creams natin na may centella or hyaluronic acid because these are promising products, okay? But not one product is effective for all. Okay? Hindi siya one size fits all. Okay? But I think this is more important to underscore. To prevent, you have to educate women to have proper diet and exercise. You know, malnutrition is also one of the leading public health concern in the Philippines. So malnutrition is not just having poor nutrition na malnourished, payat. Okay? Overweight, obesity is also a form of malnutrition because it means that you're not getting the proper nutrients that your body needs. Okay? So, if we educate women to consume proper amounts of food containing zinc, vitamin A, vitamin C, vitamin D, and even protein, we might improve the appearance, okay? And the overall health of the woman. Okay? So, again, no, very limited yung research showing that almond oil, cocoa butter, olive oil, or vitamin E will be effective. But, again, no, so there's no harm. Okay. So, that's the boring part. I promise. Yun na po yung pinaka-boring. Okay? Pero yun yung mga lumalabas sa quiz pag nag-e-exam. Okay, sige. So, why is it important to talk about stretch marks? So, you were promised a discussion on women's health. Why talk about stretch marks? Why? Well, you know, it's something related to saan ba natin? Ayan, okay. So it's something related to a woman's perception of herself or body image. Body image, okay? So not everyone is self-conscious about it. Some are proud that they have stretch marks, no? Because I'm a mother, I have stretch marks. Okay? But you know that corresponds, no? It has a certain impact on the woman's overall health. Okay? So there's a study. So this is a very important study. This is a very interesting study, actually. So they surveyed, no, more than 2,000 women, pregnant in particular, no? And they asked about the individual experience of each woman. Okay? Whether they have positive or negative self-perception during pregnancy. So in the pool of women, yung subjects, more than 2,000 women, it oscillates from positive to negative. Positive because pregnancy is supposed to be a positive experience. It's not a disease, in fact, no? It's a physiologic process that the woman undergoes, no, to give birth, to bring forth new life. Okay? So it's positive in that regard. But there are a lot of changes happening during pregnancy and a lot of complications can occur, turning that positive experience into negative experience. And changes in the woman's body is one such factor that affects whether a woman will have a positive or a negative pregnancy experience. So the differences in the changes in the body, of course, multifactorial. So a lot of factors can affect it. Genetics, the woman's socio-economic status, okay, antenatal care, the quality of healthcare that we provide, so kasalanan ng doktor. Okay. And then other self-perceptions that may be brought about by external factors. Yung social media. Okay. Yung mga pregnancy photo shoot, di ba? Nakaganon. Naka-revealing sila. Oy, ba't ang ganda nung kanyang tiyan? Di ba? Why yung akin hindi? Hindi tuloy ako makapag-photoshoot ng nakapanty lang. Okay? But of course, there are Photoshop. Di ba? Paano mo alam na ganun talaga kakinis, right? Yeah. So sometimes, social media causes negative body image perception, no, for women. So, and if a woman develops negative body image perception during her pregnancy, it is actually linked. This is as a result of a study, okay? It's linked to development of possible mental health issues. So you've heard about postpartum blues or postpartum depression, yes. So right now, we call it, it's not postpartum depression lang. It's a postpartum depression spectrum. So when we say spectrum, it can range from physiologic na postpartum blues, na after they deliver, you see some mothers don't wanna hold my baby, iyak lang siya. Tapos, Filipino culture, ang arte naman neto. At ang arte, pagod ka lang, gano'n, no? But it's a real response. And it can progress to clinical depression. It can progress, no, to depression significant enough that some women kill themselves. I have several patients, no? Especially those who suffer from medical problems during pregnancy, hypertensive, diabetic, they really become depressed after. Those who underwent fertility treatment, diba? You would think after they went through that rigorous fertility treatment and they finally have a baby, they will be happy. But no, they can have depression and even to the extent of killing themselves and their child. So ganun siya ka significant. And unfortunately, in the Philippines, we neglect this part. Okay? We do not want to acknowledge, I don't know why, the mental health issues that women suffer. Okay? If a woman is dissatisfied with her body, it can have significant mental, emotional, and physical effects on her well-being. And if you look here, no, it has impact not just on the woman herself. It also affects the child during pregnancy. So child rearing. So we have this concept now, the International Federation of Obstetricians and Gynecologists, focus on prevention of NCDs, non-communicable diseases, so hypertension, diabetes, no? When we focus on just pregnant women, or those women trying to get pregnant, reproductive age group, tayo yon. Tayo yon. Okay? Reproductive age. So if we ensure women's health, we can ensure the health of the succeeding generation, right? Because what you see now, our thinking should be not just the immediate outcome. Buhay. Importante, buhay. Di bali ng peklat, basta buhay. Diba? But we should also consider the quality of life of these women and their offspring, because that will affect the family as a unit and the society in general. So, coming from a government hospital, we know that yung economic repercussions niya, no? Buwis ng bayan naman lahat yon, di ba? Okay? Yan. So, I think, yan. So, talking about stretch marks, it's not as trivial as I once thought. So, before coming here, I am having some doubts na talaga naman talaga stretch marks among CEOs. But yes, no, it is an important topic because it correlates to women's wellness. Women's wellness. So, when we say women's health, it's not just the absence of disease. It's not just you're well, wala kang sakit, wala kang gamot na tinitake. But health is equivalent to wellness, meaning not just physical, but mental and emotional as well as social. So I really applaud the activity of this women's forum and this organization for gathering powerful leaders, women leaders, to in pushing their advocacy, no, to empower women, and the health sector, I think, will really contribute a lot. So further collaboration is we're really looking forward to further collaboration po. So with that, no, so we want to empower women so that they can have a positive body image, so that they will be well, so that every family and the entire society will also be well. So with that, thank you very much.